Hi everybody, it's Dr. Lori Dover from the Two Chiros. Today I'm going to address a question that we get pretty well every day in the clinic when people come in pain or discomfort. Question is, do I use ice or do I use heat? So when you're trying to figure out whether to use ice or heat, consider whether the injury, your pain, is new to you or is it older. If it's something new to you, we call that an acute injury. If it's something older, we consider that a chronic injury. So let's start with acute. An acute injury would be you sprained your ankle, you bent over, picked up something you weren't supposed to pick up. So if you have something acute or new, consider ice. A new injury, an acute injury, is going to come with pain, going to come with inflammation, swelling, maybe even some redness. So the purpose of the ice will be to take down the pain, numb the area, help with some inflammation. Next question, how long do I leave it on for? Good rule of thumb is 10 to 20 minutes. Don't leave it on for any longer than 20 minutes. If you want to repeat it, if you have it on for about 20 minutes, leave about an hour in between and then go again for another 20 minutes. That hour in between allows your body, your tissues to get back to normal temperature, and then you can hit it again. All kinds of forms of ice you can use. A gel pack is great. They're at pretty well all the drugstores, very inexpensive. Now they're pretty cold. Some people are brave enough to put them right on the area. If you're not, just use a very thin tea towel. If you're going to use a towel, though, leave it on for a little longer. Some of my patients like a good old-fashioned bag of frozen veggies because they actually will mold really nice to the area that you want to put them on. If you are putting the ice on a bony area, say an elbow, wrist, shoulder, you don't need the full 20 minutes because there's not much tissue there. But if you have a little thicker area of tissue, maybe a thigh or a low back, consider all the way up to the 20 minutes. So now let's get to a chronic injury. If you have a chronic condition, it's something that's been with you for a while, you're nearly always going to get tight muscles, stiffness, not very much range of motion. So we want to put heat on that. Heat will bring some nice, beautiful new blood to the area, will soften the tissues up, loosen the muscles, you'll get more range. Heat you can leave on a little longer. You could say do 10 to 30 minutes. Again, leave about an hour and do the heat again. All kinds of forms of heat you can use. I love a bean bag, magic bag, beautiful for the neck. It goes around the neck nicely, fits into the crick of the neck. I'll actually safety pin it or put a scarf or a towel around to hold it in place. This is a really neat thing too you can get. Most of the drugstores have them. It looks a little strange, but it fits nicely on your back. It goes down to, say, the upper back a little bit, fits over the neck, and then you have good old-fashioned heating pad. Just don't fall asleep on these, please. Now, what if you're not sure? You try the ice, you try the heat, you're not sure if either one of them is working. You can alternate, go back and forth. So put the ice on, again, your 10 to 20 minutes, leave an hour, do the heat, 10 to 20 minutes. Go back and forth all day. The key is to listen to your body. It will tell you whether it likes it or not. If you put the ice on, for example, and it starts to ache and you go, oh, I don't like this, okay? Body doesn't want the ice right now, put the heat on. Conversely, if you put the heat on and you think, oh, that might have made it worse, go with the ice. My patients with the heat will say to me, it felt really great while it was on, but within 15 to 20 minutes after I took it off, it was right back to square one again. Your body will tell you. Remember too, ice and heat are a really mild form of therapy. The chances you're going to hurt yourself with these applications, not very great. Now there's always exceptions to this. Remember, this is sort of for the average person, for the average condition. Athletes do full ice baths. I do not recommend that. So you might be getting guidance from your physiotherapist, your chiropractor to do other things. So just remember, this is sort of the average thing for the average person. Keep that 20 minutes in your mind, an hour off, another 20 minutes on. So hopefully this has cleared up a couple of things for you and answered a couple of questions. Thank you for tuning in, and we'll see you again.